Hi everyone, I'm Trey Barmy, clinical pharmacist and host of this podcast. I'm pleased to welcome you to our Seacroft Primary Care Network podcast. It's a chance for you to meet the people involved in your care and to have an insight into how practices work together to create the network. Today, we are meeting Ashley Cohen, who is PCN Community Pharmacy Lead for Seacroft. Welcome to the podcast, Ashley.
Hi there, thanks for having me.
So today we're going to focus on the new Pharmacy First programme. So we're just going to ask Ashley a few questions about that. So Ashley, what is the Pharmacy First programme and how does it make it easier for patients to get healthcare services?
Okay, well, the Pharmacy First scheme has been recently launched only a few months ago, and it provides professional healthcare advice, treatment, and also medicines for common illnesses from your local pharmacy with a qualified pharmacist, often without the need of an appointment.
Okay, sounds very good. So what are the main benefits of the Pharmacy First service for patients?
Well, there's many benefits really for the Pharmacy First. So pharmacists, as I've mentioned, are highly qualified healthcare professionals. They're experts in medicines. So we can give you the same advice and treatment for common illnesses as your GP. Pharmacies are often open during normal business hours, and many are open late and on Saturdays and Sundays. So you can access them more easily than going to see your GP. Sometimes it also might be quicker and easier for you to go and see a pharmacist than to wait for a GP appointment. We're hearing more and more now that GPs have got capacity issues and routine appointments are booked up. So you can often walk in and see your pharmacist without the need for an appointment. But it's important to check this with your pharmacy before attending. And most importantly, anything that you do say to your pharmacist is treated with confidence in the same way that it is with your general practitioner.
Great. So how does the Pharmacy First service help reduce the workload on the NHS?
So we understand, and I say we as pharmacy professionals, we understand that it's difficult to get urgent and same-day appointments at your local GP practice because they're also under huge pressures within the system. So the Pharmacy First scheme was achieved really with an aim to free up some of those appointments from your local GP practice so they can spend more time with the more complex cases within their practice. So by freeing up these appointments, it allows people to be triaged to come and see a community pharmacy and increase capacity with the NHS primary care system.
Could you give some examples of issues that patients can get help for through the Pharmacy First service?
So there's lots of common illnesses that we can help with, and they range from conjunctivitis, hay fever, diarrhea, burns, coughs and colds. And you can walk into any pharmacy and get that advice, as you probably have been already. But you can also be referred directly from your doctor's practice for 7 common clinical conditions. And these common clinical conditions, you can get medication often available without the need of an appointment on the same day. So if you suffer from the following 7 common clinical conditions, you can walk into a GP practice or you may be referred by your doctors. And these are sinusitis for adults and children aged over 12, sore throats in adults and children aged over 5 years, earache for children between the ages of 1 and 17, an infected insect bite for adults and children aged over 1, impetigo for anyone aged over 1, shingles for adults aged over 18, and also uncomplicated urinary tract infections in women between the ages of 16 and 64. So, as I've mentioned earlier, you can be either referred from your local practice or you can self-refer. So that means walk in to any participating pharmacy for advice and treatment. All the treatment and advice that we'll give will be free. And if your pharmacist believes that the condition needs further review, they will recommend where to get more advice. And if you normally pay prescription charges and we decide to give you a prescription, the normal prescription charges will apply if you pay for your prescription charges.
So how does the service allow community pharmacists to play a bigger role in supporting patients' health?
Okay, so self-care and self-referral are things that we've been doing anyway, but it's been mainly informal. And many of the common illnesses that people regularly suffer from are treatable with over-the-counter medicines. And if you're feeling unwell and have any of those common illnesses that we've listed previously, you can access Pharmacy First. So it's really important to use the pharmacist to help treat normal common illnesses and leave maybe the GP practice for more complex conditions. So access your pharmacy as normal, either through their normal opening hours or when speaking to your local GP practice, you can always ask them if they're participating in the pharmacy first, and they may refer you to a participating pharmacist for more treatment and conditions.
With the service being around for a while now, can you share any success stories or positive results from using the Pharmacy First service in your area?
Okay, so it has been available for some time. We only really went live formally at the beginning of February, so we've got about 3 months worth of data. So I can share a number of individuals that walked into our pharmacy, could not get an appointment with their GP practice that day. And I remember a lady that came in with a very acute urinary tract infection. Couldn't get an appointment for the doctor for the next 2 or 3 days, wasn't aware of Pharmacy First at the time, came in out of pure desperation mid-morning, and through a 20-minute consultation was seen, was diagnosed and prescribed an acute course of antibiotics, given it that same day, and it was allowing the patient to continue with their normal work same day. And she actually came back 2 days later to say that the symptoms had been eased later on that same day. So it's really important that if people are finding it frustrating to get into their general practitioner, speak to your local pharmacy. We are able, we are willing, we have been trained to provide specific advice for some of these areas. And it's great because most pharmacies can do this without an appointment. So it stops you having to kind of feel like you're in that queue at the GP practice, or being informed that there are no appointments that same day. So if they can't help you also, we can signpost you and help feed you back into the system if we feel that you do need to see a practitioner. So
thank you. It sounds like it's making a big difference already, which I'm glad to see, and hopefully it carries on making a big difference as well. That's all the questions we have for today. Thank you for Ashley for attending this podcast. I hope you enjoyed it. Please like and share if you enjoy the podcast. Ashley will give me some information to put in the description as well. So if you want to find out more information about the Pharmacy First scheme, please see the description. Well, thank you for joining us, and we'll see you next time. Thank you.